So for part 3 of our knee pain series is our patellar tendon. So we have a tendon from the quadriceps. It becomes a common tendon and it goes over the kneecap and attaches to your shin bone. So the patellar tendon, as we call that, can be another source of pain. So if you have an acute inflammation of the tendon, that's called tendonitis. We also call that jumper's knee. If you're an athlete and you do a lot of jumping, like if you were a basketball player and you have front knee pain, it's usually coming from the inflammation of the tendon itself. So usually that just means we have to do a lot of anti-inflammatory treatments. So icing is probably the primary thing for you to do at home. Rest if possible, so taking off the load from jumping all the time. Sometimes that's not always possible, so there are things we use like a strap. It's called a Cho-Pat strap, where we put a strap around the kneecap just to reduce the strain that we put on the tendon. It's a compromise. We don't want to use a Cho-Pat forever, but if you're in season, for instance, we might use that just to get you through and keep you on the court, to keep you playing. Others will have patellar tendon pain or issues because of not inflammation, but of degeneration. So meaning we're not using it enough. So our tendons degenerate. That's called tendinosis. So we can get patellar tendinosis, which is degeneration or wearing down of the tendon. For those folks, we want to strengthen, and we want to strengthen the tendon a lot. So what we do is what we call negative or eccentric loading of the kneecap. So essentially what we want to do is we put a load on your ankle through either a cuff weight or with the extension machine, and we want you to slowly lower the weight down, slowly, taking about 8 to 10 seconds. And we want to come up quick and go down really slow, 8 to 10 seconds. And we want to slowly lengthen the tendon and strengthen it that way. So you can overuse and underuse the patellar tendon, and there's a treatment for both. So that's a common one that we also see, very treatable. I hope that these series of videos help. Knee pain is very common. Part 1, we talked about osteoarthritis. Part 2, we talked about patellofemoral syndrome or kneecap issues. And for this one, we talked about the tendon. There are others, this is not fully encompassing. There are others that cause knee pain, but these are the most common ones that we see. I want to help you understand. There's treatments for it as well. All right, so I hope this helps, and we'll see you on the next Ask a PT series.